Now we'll quickly be moving to look at the different causes of kidney disease. Different causes of kidney disease. So for this next cause which we'll be looking at, we'll be looking at what is known as a nephrotoxic substance. So nephrotoxic substances as causes of chronic kidney disease. Now of course, when we say something is nephrotoxic, we say that thing is like harmful to the nephrons, which are the what? Basic units of the kidneys, right? So overall, later on, it will damage your kidneys. So nephrotoxic. So nephrotoxic substances, we say that they are significant, but often an under-recognized cause of chronic kidney disease. So sometimes you might have a different disease condition. They are treating you for that different disease condition, and the drugs they are using to treat you for that disease condition can actually be harming the kidneys. Do you understand? So anything nephrotoxic substance is a substance that can damage the kidney either directly or indirectly. So it will lead to progressive loss of function over time. So what are nephrotoxic substances? They can be chemicals, they can be drugs, they could be toxins found in the environment. So primarily they damage the nephrons. Okay, that's a filtering unit of kidneys. So, and if you are talking about in children, the kidneys are still developing. They are very much more vulnerable to all these damages. Okay, so common nephrotoxic agents, of course, drugs are the main, so aminoglycoside drugs, non-steroidal anti-inflammatory drugs, chemotherapy drugs, calcineurin inhibitor drugs like cyclosporins and tacrolimus. Then sometimes maybe they want to do an imaging on your body, so they now give you some contrast so that the imaging can be clear. It's for a good purpose, but not knowing that these things have to be cleared by your kidneys, so it will lead to issues with your kidney. So environmental toxins like heavy metals, industrial chemicals, contaminated water or food containing nephrotoxicants, then herbal and traditional remedies. Okay, then mechanisms of injury is there could be direct injuries to the tubules. Okay, reduced renal perfusion, immune mediated injuries. Okay, so sometimes it's your immune system that's trying to fight that, so can also damage the kidneys. Then oxidative stress and fibrosis. So cells die over time, okay, due to stress. So pediatric considerations. So for children, you are looking at things like they have an immature renal function, so the kidneys are still developing, high metabolic rates, okay, and longer life expectancies. So there's more time for damage to accumulate. Do you understand? So limited ability to metabolize and also excrete toxins. So it's not every toxin that can be put out by a child. Okay? So diagnosis and monitoring. You do all those blood tests, urinalysis, imaging, kidney biopsies, just to confirm the disease condition. Alright. So that was it. Just talking about nephrotoxic substances. Of course, the treatment or prevention could be you should stay away from any substance that is harmful to the kidneys.